This is Hallux Rigidus. Basically, you get a huge bone spur that prevents the top of your big toe joint from bending up. So this is normal. That's a big spur, Hallux Rigidus. That's what it looks like. And your big toe cannot bend up because of this thing, and then you start getting severe pain throughout the joint. So that's what we're looking at right there. Different than a bunion. A bunion's the bone actually buckling out to the side. You can see that the bone's dislocating off to the side, not so much an extra bone spur. So that's bunion's more of an angle change between the two or swollen tissue over it. But that's not what we're talking about right here with Hallux rigidus, So these are bunions. Again, this is Hallux rigidus. So you can see the difference between a bunion right there and Hallux rigidus on top. So this kind of stuff is worthless. Don't spend your money on this. It's not indicated for this condition. So these, although claims are made, it doesn't do anything. Pads like this can work great. If your problem is simply the top of the bone rubbing against the top of your shoe, stuff like that will work really great and prevent the rubbing. Taping, preventing the big toe from rubbing up, can theoretically help, but as it prevents the jamming in the joint. But who wants to put this on every day? It's not practical. What is practical is plates like this that go into your shoe. They stop your big toe from bending up. So you put these in. These work great if you can tolerate it. We've had success rates, especially people who are on their feet all day, over 50%. So really, that's it. That solves your problem. And then we look at the bump again. If the bump is just so big that you don't fit into the shoe, you want to remove it. And it's as simple as that. You go through the skin and you can remove the bump. The problem is with this type of surgery, while it's quick recovery, the bone spur can come back. So the factors that caused it to happen in the first place can cause arthritis again. So here's what a spur looks like. Obviously two different feet, but here's one before spur removal, and here's what it looks like a little bit better, so you can see the joint and the cartilage a little bit better. If the cartilage is missing, in some cases it is, this might not be the world's best procedure for you, as the spur will come back within a couple of years. So the option, if the spur does have extensive arthritis, as you can see right here, the joint space is destroyed, simply to lock up the joint. It's a little bit longer of a healing process, but you know that you won't have to have more surgery in the future and your pain is better. Even though it looks like your joint's locked up here, there is zero motion before the surgery and there's zero motion after, except you're essentially pain-free if this works right. So if it's not too bad, you can remove the spur because you can still see good cartilage right there and good cartilage after this surgery. But if you're missing it, you want to lock up that joint. So getting rid of the spur, if it's just rubbing against the top of your foot, just getting rid of it will do it. If it's not joint pain that's really bothering you. There are implants, there are extra fancy stuff that's untested, untrue. But you can see if you're moving around with this a couple years, it can basically destroy all this bone here. And then you are out of luck. Your joint is toast and there's not much that can be done. Generally, you don't need a boot like this. You don't need a cast for that first surgery I mentioned. Simply being in a shoe for 2 weeks, then back into a pair of shoes is all you need right there. If this helped you at all, please visit our website where you can get even more information. And if this video did help, give it a like and a share, and we'll see you soon. This is MichiganFootDoctors.com.